Hello, my name is Williams. This physical assessment is for Professor Rhonda Cameron. This is the head, ears, eyes, nose, and throat assessment. I have my patient here. His name is Jonathan. When I approach his room, I'm going to knock on the door. I'm going to practice hand hygiene, and I'm going to glove up. I'm going to pull a privacy curtain, and I'm going to identify my patient. Jonathan, I have your chart here. Can you verify your first and last name and date of birth?
Jonathan Healy, and 05/17/1994.
I would then check his patient intake bracelet and make sure that what he is telling me, what's in the chart, and what is on his bracelet all correlate. Next, I will let the patient know what we are going to do. So, my name is Williams. I will be your nurse. We're going to be performing a head, ear, eye, nose, and throat examination. And at some point, I'm going to have to put my hands on you for palpating and inspecting. Is that okay with you?
Yes.
Perfect. So I have the consent from the patient. I'm going to go into my assessment with the head. I'm looking at the shape of the head. I'm looking for symmetry. I'm looking to see if there are any lumps or masses, if there are any lesions, and I don't see that. I'm moving in to palpate the skull. I will get consent from the patient. I'm going to put my hands in your hair to palpate. Is that okay?
Yes.
So I touch the skull. I'm feeling for any deformities, any abnormalities, any deformations. I'm looking for lesions. I'm checking the hair disbursement. I'm checking to see that there's no dandruff or parasites, and I do not see any. So moving down the face to the eyes, I'm checking the eyebrows, the eyelashes. I'm looking to see that the eyes are positioned appropriately on the face with no sagging or drooping. And then going into the eye exam itself, I would use my ophthalmoscope. I would get a red reflective light from the pupil. I would also see that the sclera is warm, yellowy orange with no distended vessels that would suggest bleeding. And then I'm going to do a pen light vision test. I'm going to grab my pen light. I'm going to shine the light from one side into each pupil and look for dilation and constriction. So Jonathan, I'm going to shine my light from one side into the pupil. You will look straight. Coming in, I see that the pupil dilates, and not only this one, but both eyes dilate equally, so they're equal and symmetric. I do the other side. I see that that pupil dilates and constricts upon me pulling back the light. Both of the eyes constrict and dilate at the same time, so they are equal and symmetric. Next, in the eye exam, I would use a Snellen chart. For vision, I would have the patient stand 20 feet away from the Snellen chart and have him read the smallest line that he possibly can. I will also perform a nearsighted vision test where I place the same chart in front of him at about 14 to 15 inches away from the face and have him read the smallest line that he possibly can. I'm also going to check the conjunctiva and the tear troughs. I'm checking to see if there are any debris, any distended vessels, any redness, draining, discharge in the conjunctiva sac. So I will preface the patient. Jonathan, I'm going to place my hands on you, pull down your lower lid, and have you look up while I check the conjunctiva. Is that okay with you?
Yes.
So I start with this eye, I pull down the conjunctiva, go ahead and look up. I'm looking to see that there's no debris, there's no discharge, there's no drainage, there's no redness or irritation. There's also no lesions on the eye or in the trough itself. I check the other side, no redness, drainage, lesions, debris, any buildup in the tear troughs. So he's all set there. Next, we're going to move to the ears. I'm going to let the patient know that I'm going to palpate the ear and look for any discomfort or tenderness. I'm going to do that by palpating on the pinna and the lobe as well as the tragus. So I'm going to palpate your ear. Is that okay?
Yes.
So I start with one ear. I'm pulling back. I'm just going all around the auricular meatus. I'm pushing on the tragus. Do you feel any discomfort or tenderness?
No.
Nope. So I walk around on the other side of the patient. I'm feeling on the pinea, I'm feeling on the lobe, I'm feeling on the tragus. Do you feel any discomfort or tenderness?
No.
No. In addition to palpating the ear, I'm also going to look in and around the ear. So I'm using my ear scope, I'm looking inside the ear with the handle up and the scope downward. Looking into the ear, I'm going to see that the tympanic membrane is round and white, almost like a pearl, and that's sitting in the center of the ear. I'm looking for any lesions, any bleeding or discharge. I'm also looking for any excessive earwax, and I do not see any. I will move to the other ear. I will insert my scope. I'm looking for the tympanic membrane that's white and pearl-like. I'm also looking to see for any excess earwax, any bleeding, discharge, or debris in the ear at all, any lesions, and I do not see any. Next, I will perform a hearing test. We'll do the finger rub test where the patient occludes one ear, and I will rub my fingers together until he can hear it, and then we'll do the same on the other side. So go ahead and occlude your left ear and tell me when you can hear it.
Yes.
Okay, and then occlude your right ear.
Yes.
Perfect. Next, we are going to do the nose. So I'm looking to see that the nose is symmetrical, that each nostril is appropriately shaped, that there's no discharge or bleeding, there's no lesions on the nose itself. I'm going to ask the patient to raise their chin so I can look inside with my pen light. Go ahead and raise your chin up for me. I'm looking inside the nose here, and I see that there's no swelling, there's no bleeding, there's no discharge. The hair inside the nose is dispersed appropriately, and there's no debris. I do not see any septum deviation or shelving. I'm going to ask the patient to lower the chin, and he's going to include one nair, breathing in and out on each side so we can check to see if his airflow is appropriate. So go ahead and occlude your left nair. Breathe in and out. In your right nair. In and out. And we see that his air through his nostrils is clear and unobstructed. Moving down to the mouth, I'm looking to see that it is appropriately placed on the face, that there's no drooping or drawing. I'm looking to see if he has any chapped lips, any debris that has accumulated on the mouth. I'm looking for any cracks or scars, any abnormalities on the outer mouth. I do not see any, so I'm going to ask the patient to open their mouth. I'm going to check inside. I'm looking for cavities on the teeth. I'm looking for any gingivitis or plaque buildup. I'm looking on either side of the buccal mucosa, which is the inside of the cheeks, to see that they're pink and moist, free of lesions, distended vessels, or bleeding. I'm looking to see that the top palate or the roof of his mouth is a lighter pink or white with no lesions or distended vessels. I'm looking to see that his gums are pink and moist. I'm looking to see that his tongue is free of lesions or abrasions or bleeding. I'm going to have the patient stick out their tongue. Go ahead and stick out your tongue for me. Move left to right, up and down. I see that the patient has full range of their tongue. Next, I'm going to check the uvula and the throat. Go ahead and say ah. I see that the uvula is hanging straight in the middle of the throat and is symmetrical. Also, it moves upward and in with phonage. I'm looking at his tonsils. I see that they are visible, but they are not inflamed, and they have no plaques or distended vessels on them, and they are an appropriate pink and not red. You can go ahead and close your mouth for me. Next, moving down to the throat, I'm going to check to see that the trachea is symmetrical and placed medially in the neck. I'm also going to look for any neck involuntary movements. Again, I'm also checking the skin to see if it's free of lesions, scarring, or any abnormalities. Our patient today has a beard, so I'm really going to lift the beard so I can see the neck and all of its structures to make sure that everything is appropriate and there are no abnormalities. So I'm going to check your throat, neck, and tracheus, and to do that I'm going to lift your beard. Is that okay?
Yes.
Perfect. So I'm going to have you lift up. I'm moving his beard out of the way. I'm palpating the sides of his throat. I see that the trachea is symmetrical and even in the middle of the throat. I don't feel any masses. I don't feel any tumors or feel any warmth that would suggest swelling. Next, I'm going to go towards the back of the patient and we're going to check range of motion of the neck with resistance. So I go to the back of the patient. I'm going to put my hands on either side of the head and have him turn one way with resistance and then the opposite way. We're looking to see if he can do this with ease. So, I'm going to put my hands on you. Is that okay?
Yes.
Perfect. I put my hands on each side of his head. Go ahead and try to move to the left. He can do that with ease. Go ahead and try to move to the right. He can do that with ease. I'm going to now place my hands on the patient's shoulders. I'm going to push down with resistance as he pushes up. We'll see if he can do that with ease. Go ahead and lift up. He can do that with ease. While I'm behind the patient, I'm also going to palpate for the thyroid. So I'm going to place my hands on either side of the trachea and have the patient swallow. The thyroid should fall up or slide up and then fall into my fingertips. So I'm putting my fingers on the neck. Go ahead and swallow for me. And I feel the thyroid rise and fall in between my fingers. Moving back around the patient, I'm going to give him another general assessment, looking at his head, ears, eyes, nose, mouth, and neck on either side. I'm going to finish by doing the lymph node assessment. So I'm going to start at the front of the head here. We're going to do the parotid. Oh, before I palpate your lymph nodes, so I'm going to palpate your lymph nodes. Is that okay with you?
Yes.
Perfect. So we're going to start here at the parotid, kind of near the earlobe. I'm moving up to the pre-auricular, moving back to the posterior auricular, downward the occipital, downward to the submental, going up to the very front of the chin, the, submandibular in the back, submental here by the chin, and then I'm moving onto the neck, just underneath the ears here and like underneath the jaw, that is going to be the tonsillar. Then we also have the superficial cervical, the deep cervical, and the supraclavicular. And I feel that his lymph nodes are not enlarged, which would insinuate inflammation, so there's no abnormality there. That completes the head, ear, eye, nose, and throat assessment. Upon finishing it, I'm going to ask the patient, have you experienced any discomfort during this assessment?
No.
Wonderful. I'm going to deglove. I'm going to perform hand hygiene. I'm going to remove the privacy screen. I'm also going to make sure that all of his personal belongings and his call button are close by. Also, if I had to do this assessment with the patient lying down and the bed raised, I would make sure that the bed is completely lowered and that the patient is safe before leaving the room. Jonathan, it was a pleasure to give you this assessment and I will see you soon. And then exit the room.